Okay, guys, thank you so much for joining our webinar of what makes a top 5% applicant with Medentors. So, for those of you guys who don't know me, my name is Mohammed Mufti. I'm currently a second year medical student, and I'm also one of the mentors at Medentors. And the aim for today is what I'm going to be doing is breaking down what makes a top 5% applicant for medicine and dentistry. What are the key steps to take in your application process to make sure you stand the most competitive of students? Because as we're going to get started very shortly with this presentation, we're going to begin to see that these are the two most competitive degrees to get into in the UK. Yeah. And because of that, the entry requirements are going to be quite high. We need a way of dissecting that, understanding what the top applicants do year on year. Because what I've noticed from my years of experience and by working with, multiple students, loads of different students, is that there's a similar patterns between those that get in and a similar patterns between those who unfortunately don't manage to get admission. And that's why I'm here to break for you guys. So we become of those in the second group of people who always get in. Okay, that is the key focus for what we want to aim for today. All right, guys. So let's get started without further ado. So for those of you guys who don't know us, welcome to Medentors. We are a group of UK medical dental students, doctors, dentists, and high achieving university students who assist students in not only getting into their dream choice
Sarah,
university, but by giving them the
join the
right
link I
pathway into
sent
doing
you
that.
now.
If you could please mute whoever that is.
Just
Thank you.
join.
Um, yeah, so that is what we do. And part of what we do is we have an academy branch which helps you guys achieve excellence in your A levels through our online tutoring platform. We also have our admission services, which is, what we're doing today, going through free webinars on how to achieve those top grades and get admission, as well as working with schools. We do lots of in-person things with schools, community centers, all across the UK. All right, guys? So this is part of what we are. And so far, we have managed to partner with 20 plus schools and organizations across the UK, showing our level of trust within the communities, and work with 3,500 plus students. And 90% of our students, think about that, 90% of our students achieve, manage to get a medical and dental offer if they stick with us long enough to go through this application process. All right, guys? So, plan for today. What are we going to be doing? What are we talking about? And how are we going to break things down? Well, we're going to begin off with the foundations, the starting steps, the building blocks. How are we going to build those? What we need to do right now, whether in your year 12, 10, 11, 9, wherever you are, how you can build to that final step until when it's time to give off your application, what you need to do to actually stand out competitively. Then we'll look into the specific hurdles in detail. As many of you guys have known, and if you've attended previous webinars of ours, there's a lot of hurdles into getting into medicine and dentistry, and it can be quite hard to balance that alongside doing your A levels, your GCSEs. And a lot of students do begin to struggle based on the fact that you're juggling two things at once, and that's not easy for everyone. So my aim for today is to give you guys the most straightforward answers, so it's easiest for you to juggle them. Because I remember going back, been a while now since I set up my application. It was difficult to manage everything, and I was doing three A levels and EPQ on top of that, and loads of extracurriculars. I wasn't having the best time managing things. I needed a system, and I'm going to go through what worked with me and what can hopefully work with you guys in your journeys as well. We're also going to be showing some resources we have. If you go on our link tree as well, there's tons of free resources written by top scoring, top 1% scorers across all of our stages who break down the exact things you need to do at every single stage. So please, 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 if there's one thing you do after this talk, read those resources. That's going to help a bunch. And then we'll have a little Q&A at the end as well to finish things off. All right, guys? So that is the plan. Right. So here's a quick introduction to the timeline. You may have already seen the slides many times before, and it is available on our YouTube through some of our other webinars. But these are the key steps we're going to be touching on. As you guys can see, in years 7 to 11, we're building our foundations. We're building the key strategies and skills of what we actually need to do, skills such as communication, empathy, getting involved in school, doing things like drama, etc. Then in year 12 is when you start thinking about your specific application and you decide, hang on, what do I want to do when I grow older? Medicine, dentistry, or whatever it may be. You take work experience, and you don't just finish with work experience, you take it a step further. You get involved in volunteering, in supercurriculars, in doing things to show your interest in the career. So gradually, as you guys follow along, we get to this year 13 personal statements step. Yeah, guys? We've already got everything built up so that when we send off our application, everything goes through smoothly. All right, guys? Then after that, we take our UCAT exam, apply strategically to certain universities that would take us on board, take interviews and A levels. Again, we'll go through all of that in much more detail as things go. And if you want to go into this with more information, I'd highly recommend to check out one of our previous webinars covering the application cycle. Okay. So these are the odds of getting into medicine and dentistry. Okay. Many of you guys will have already seen the slide. These are the two of the most competitive degrees to get into the UK. Every single year, every single year. There are roughly 24,000 people that apply for medical school, and only 8,000 of them, so around a third, 7.5 thousand, my screen's saying, end up getting into medicine dentistry. And this is taken from the latest available application cycle. This is the latest data. Many websites you will see will be very outdated, which is why I always recommend to double check everything with our resources, because that's what we follow, the latest cycle. And you may have heard that medicine is more competitive than it is. It's not as competitive as some people may make it out to be. Because in the last couple of years, especially to do with, systemic changes within the NHS, a lot of young people have been put off doing medicine. And actually, the offer rate's actually gone up, considering compared to when I, applied for medicine. So things really have changed. On the other hand, we're looking at dentistry, which is it's not even a debate now. By far the most competitive degree to get into the UK. And that's because quite simply it offers you a better lifestyle and, work-life balance and pay in other regards. A lot of people find it preferable to, live a balanced life working as a dentist. And that's why it's so much more competitive. But it being such a good degree comes at a cost. The hurdles are much greater. But that being said, both of them have the exact same hurdles, and it's sort of applicable depending on which one you do, on how to achieve each one of them. And anyone, and I mean anyone, can be in that green bracket for dentistry and for medicine. And that's hopefully one to break for you guys today. Okay? So firstly, the foundations, where we're starting off with. If we go all the way back to the start of our timeline, the foundations is where we start. And this is, as this image shows, the building blocks for how you want to build on things, how you want to develop yourself as a person. This is everything we need to be involved in to make sure we stand out for this career. You want to first start off by building your communication skills. Get very comfortable with that, because in year 13, you're going to be sitting across a desk of another person and it will be an interview. You'll be asked to explain why you have a passion for medicine or dentistry. What have you seen in the dental clinic or your medical hospital work experience? What made it stand out to you? Okay? You're going to show all of these key skills and competencies, and it's important we build our communication skills young, whether we're, year 10 or 11 or even 12, wanting to do a school captain role, public speaking, debating, anything, get involved, because that would have helped me, especially when I applied, so much more. Okay? You also want to build work experience, which is something I'll get into, and many of the other things. Okay? A lot of these will be covered in the later slides, so we will touch on those in a second. Right. Work experience. What do the top 5% applicants do at this stage of the application? Well, firstly, what is work experience? Work experience is physically or online getting an idea of what a day-to-day life is like in a career, whether it's you physically going to the hospital wards or going to a dental clinic and seeing what a doctor does. What does a dentist do day to day? Now, this is going to require of you guys to actually book it, or perhaps sign up to something that would give you online work experience. A great online work experience platform is ours, Medentors. So if you go on our YouTube channel, we've got Medentor Society, which is essentially our community that gives work experience and insight into careers. We've got 5 series going on at the minute. So we've got couple with dentistry and 3 with medicine. So definitely look over that. Now, what this work experience will require you to do, and the good thing is universities, they're not very picky about online or in-person work experience, because they understand it's not easy to get work experience. A lot of dental practices, a lot of medical practices, they don't like little sixth form kids walking around observing them. It's difficult, especially with the state the NHS is. And that's why medical schools and dental schools, universities are okay with that. As long as you have some sort of an insight, even if it's not medicine, even if you went to a pharmacy clinic, as long as you have some sort of understanding, you've seen it and you care enough, and your personal statement shows that you have an insight into the career, it doesn't matter. So, what do we do in my work experience? Now, I would argue, and I've said this in previous webinars, that this is the most important step of the application cycle. Why? Because it actually tells you and it shows you in depth a raw, unfiltered image of what the career is like. And that actually helps you decide if you want to do it or not. Because a lot of people, especially from certain backgrounds, are, pushed into a career of medicine and dentistry because it's put on a pedestal as a great and sustainable career. And it's true, it may be in certain regards, and that may be a reason why you're following it. But this will actually make you decide for yourself if this is what you want to do. When I was on work experience, I went to a surgical ward, and obviously, me at the time, I wasn't 18, so I wasn't old enough to see surgery. And I had a fellow peer, she was 18, and she was allowed to go see surgery, etc. When she saw the surgery in her work experience, she fainted and dropped out of medicine entirely and now just wants to go and study law. And that might be your experience as well with you as a person. You might come across certain aspects of medicine that put you off it. And it's good that you get it out of the way early so you don't have to, so you're not in final year of medical school and then you want to drop out then. That might be a bit too late for some people. Okay? So definitely this is what's going to show you if this is the right career for you. Okay, so you went into the ward and you're actually interested. You see you like what you're seeing. Now you want to go on forward with it. What do you do? Well, here's what you're going to do in your work experience to make the best out of things. Step number one, speak to the doctors, speak to the dentists, speak to the multidisciplinary team, the nurses, the receptionists, the staff, everyone. Get an insight from everyone about what their day-to-day tasks are like, what are the routine procedures they're doing, and what do they actually think about the career. Do they like what they do? Do they feel like they get enough of a rest? Do they feel that, adequately compensated by pay? That's something that's important for all of us because that's why a lot of us want to work. Are these things we actually look forward for our future to going into? Think about these things and make a comparison with other careers you've got in the back of your mind. Okay? And try to ask them specific questions like, how is it maintaining a family alongside working as a doctor? Is that manageable? Oh, maybe you're an athlete. Do you think it's possible for me to play a sport alongside being a doctor? Whatever interests you have, be specific. Ask them. This is the only opportunity you're going to get. And that's why we host our webinars on Medental Society for you to speak with these doctors and dentists in person, which is why I emphasize so much to attend these, all right? Also, what you want to do is note down some of the routine key procedures they're doing. What are they doing day to day? And is this something, think 20 years down the line, can I see myself doing that? Okay? And another thing is, and this is something that struck out to me was a lot of people get put off certain careers, and this is more common in dentistry than medicine because they perceive it as boring. Now, you may perceive it that way because you're just observing, you're not actually applying it yourself. So, what you could do is understand some of the skills in medicine and see if you've applied them in your life as well. For example, when you're watching a dentist do a restoration or a tooth removal or whatever procedure it may look boring watching someone do it, but maybe if you know that in your free time you like to do origami or you like to draw or you like working with your hands, um, and you like to bake and stuff, you might find that actually I do like working with my hands. I do like my dexterity. I just don't like watching someone else do it. So have a bit of insight as well. Do I have the right skills that fit for the job as well? And is this something I'm building on? Now that you've done that, the next thing is, and this is very important, this is going to go a long way to help you out in the future. Keep a small A4 whatever notebook with you and keep it handy to write down notes. Record short anecdotes. These are going to be gold, literally gold, when you get to your personal statement stage and your interview stage. Because these anecdotes, these little small things you saw in your work experience, when you look back at them, you reflect on them, and you talk about what you saw that was unfiltered and came out in front of you, that's going to stand out because it's a true innate experience that you saw yourself. And when you reflect on that, that makes it personal to you. And that's what's gonna help you stand out. So keep small notes. Oh, I saw the doctor, lower their tone, become more empathetic and use a softer tone. Their body language became more open, calm, relaxed. And they used, calmer words when working with an anxious child because they understood the child was anxious. Oh, the doctor was able to make a list of all the tasks they have to do for the day. Shows their time management skills. All the small things you see them doing, keep a note of it. When you get to the personal statement stage and the interview stage, that's what's going to be specific to help you stand out. The next thing you want to do is be specific. Write down in specific details what you're seeing. This is going to help as we get on later on. Another thing we can also do is make it personal to yourself as well. So when you're in your work experience, think about, can I actually reflect this to myself? Is this something that I see myself doing? And this is what the top 5% of applicants do in their work experience. We see time and time again every single year. Okay, guys? And this is a quick summary of what we do in our work experience about how to reflect. I'll just leave this on for you guys. I'm sure you can watch it in the recording, but it's a summary of everything I've said so far. Okay, extracurriculars and supercurriculars. Now, I don't want to ramble on to you guys all day, so I'm going to give you guys an opportunity now. Does anyone know what the difference between these two are? If anyone's attended our webinars in the past, I expect you to know this. Does anyone know? If you do, just put it in the chat. I'll give you guys a couple more seconds. Yes, Ahmed. Extracurriculars is something you do maybe for fun, not related to medicine and dentistry, and supercurriculars is what you do that's directly related to the career. Yeah, exactly. That's a very good understanding. Ahmed, do you want to unmute and, elaborate on that a bit more, perhaps, if you can?
Yeah, so basically For example, with extracurriculars, it can be something like maybe playing a sport or doing um or maybe doing like something academic, like a biology challenge, for example. So it's not directly related to medicine dentistry. And then supercurriculars can maybe doing like a research paper related to medicine or dentistry, or doing work experience also counts as a supercurricular, I'm pretty sure.
Work experience wouldn't quite count, but you can sort of link it to supercurricular. But I really like that example. Okay. And Ahmed, as well, just to continue, what is important about supercurriculars? Why is it so important for us to do this?
Because it shows your interest for the subject,
And
and
what about extracurriculars? Why would that be so important?
it shows it shows that you have a hobbies and interests and a way maybe you can, like, for example, de-stress after work, etc.
100%, yeah. It shows that you're not a robot. It shows that you're a human being. Thank you everyone for your answers as well. I'm reading through those right now. So yeah, extracurriculars is what you do to show you're someone outside of medicine and dentistry. And that's going to help you guys a lot because when you get to your application cycle, the first and very common theme that's going to come up in your interviews, personal statement, throughout the whole journey. Medicine is such a difficult degree. You're seeing what's going on in the news with union doctor strikes, with pay restoration issues, with trust issues within the NHS and systemic problems crumbling. Why do you still want to do this career? Why do you want to go into something that's so stressful and so demanding? It's because I know that I have a good, healthy work-life balance in the background, and I'm able to maintain a difficult degree and a difficult job because I have things to go fall back on, whether it's a sport, a hobby, or literature I like reading, or anything that I'm interested in. I'm able to balance my work life. That's extracurriculars for you. Supercurriculars, what's that? It's to show that you're actually passionate about the career and is going into a bit more depth. Well done for the answer. And thank you, Parsa, as well. It's a lovely answer you've written there. Okay, cool. So, what do the top 5% of applicants do when it comes to writing their extracurriculars and supercurriculars? The first thing is, with your extracurriculars, make a list of things you've done. It's very likely you have done something, but you can't think of it. Because when you make that list of achievements, that's an individual experience you can reflect on for your personal statement. So let's say you did an Olympiad, as Ahmed told us just now, or let's say you, I don't know, were school captain in year nine for just a year for your whole form, or form captain, whatever. You can talk about that experience. What change did you make? You attended some meetings, or perhaps in the Olympiad, you learned about a new equation in chemistry, or whatever, right? Talk about these things and why that makes you a unique person for your application. The next thing is if you haven't got these down, it's not too late because it's in the summer in October. For those of you guys who are in year 12 right now, it'll be around October year 13 time where you have to send off your personal statement, and that's probably when you need it by. So there's still time now. Be proactive. There's an opportunity I'm going to tell you guys about where we've got a essay writing competition at Medentors. That is something you can get involved in before October and hopefully look to attend. Okay? And that is a super curricular that all of you guys should probably have ticked off. Okay? Because that's available for everyone for free. Okay? Other things as well. You can talk about what you've done and actually use the STAR approach to reflect on that, which we're going to get on later. What about supercurriculars? What's that? How to actually, do the best in that side of things? Well, in supercurriculars, it's about finding a specific niche within medicine and dentistry you're interested in. Now, if you sit down for 5 minutes and in your head you can't find something you're interested in about medicine and dentistry, this might not be the career for you. Because if you're truly passionate about the career, there must be something in particular that interests you. I know a lot of people, they were interested in the history of medicine and they went on to study, the history of medicine, especially through the Middle Ages and the Arab lands. And I know some people who are interested in the medical tools and the changes and developments of that over time. Some people were interested in CRISPR genetic technology changing over time and personalized genomic medicine that's been going on in the last 5, 10 years and how that's changed patient outcomes. Some people like to focus on the psychosocial aspects of medicine. Me personally, for my super curricular, what I actually did is I linked it to my work experience. In the work experience, I had a GP, and my GP, he was sort of like a mini specialist in diabetes. So a side note is GPs, they're obviously generalists in a general practice, but some of them are a bit better at certain things. So the GP I was shadowing, he was a bit better at diabetes and endocrinology and like your hormonal support. So what he did is he saw lots of obese patients, and that's something that interested me because obesity is something that is influenced not only by your lifestyle choices but also your socioeconomic background, your environment, and mental health factors. And I thought it's a condition that's so well coordinated between many multiple things, that's a very interesting topic to touch on. So I actually linked my super curricular to my work experience, and my universities loved it when I talked about that because it shows application. And another thing I did is I talked about the psychosocial factors that yes, obesity can cause heart failure, hyperlipidemia, all of these things. I'm literally learning about that right now in medical school as well. But it's also contributed by socioeconomic factors and factors such as mental health. And that's why we saw a huge rise during COVID because people were at home and didn't have things to do. So things like that is why it may be impacted. Okay. So that's another thing we can talk about, why your supercurriculars would be important. The next thing you want to do is present it. If your school has a medical society, ask to present your research or your findings and say, or say to your teacher before form time, can I please present my presentation for 5 minutes about this topic? Because that's going to get you used to presenting things. And that's going to be something you can bring up in your interview and saying that I actually went about presenting my research. I didn't just research something for the sake of doing it and to put in my personal statement and to bring it up in an interview. No, I actually went ahead and presented it. That's what's really going to help you stand out as well. Okay. And that's why I've, bolded that point. Okay. Are we all happy with that? Lovely. And of course, questions and answers we can take towards the end. All right, guys, the big boss, right up there on the screen, the UCAT. Something we are all scared of if you haven't taken it already. And for those of you guys who are reapplying, it's something that you've encountered. And it's something that, I really don't like talking about all the time. But it's there and it's necessary. And it's the compulsory entrance exam to get into medicine and dentistry, okay? The University Clinical Aptitude Test. That's what it stands for. It's made up of four subsections. I'm sure you guys are aware of it by now if you haven't watched our webinars. If you haven't, please do go back and watch some of the recordings. It's made up of three subsections that are cognitive and one subsection that is scored independently called the SJT. The three subsections each are scored out of 900 points, and cumulatively they're scored out of 2,700 points because 900 times 3 is 2,700. The highest possible score is 2,700. The lowest possible score is 300 for each subsection, so 900 is the lowest score. A good competitive score to stand out. For medicine, you want anything above 2,000, you've got a good chance of getting in. For dentistry, you want to aim for that 2,150, that perhaps top decile score to stand out because we already see how competitive it can be, all right? But that being said, you can definitely get in and apply strategically with lower and higher scores. It's just that the higher score you get, the more options are available to you. There's more medical schools in the UK. There are currently 44. That's why more universities have different application criteria available. So they look at things not just the UCAT, but also your GCSEs, etc. But for dentistry, there's not that many. There's only 16 dental schools in the UK that are undergraduate. So most of them look at the UCAT. There are some exceptions that do look at other things, which is why it's really important for us dental applicants to be smashing this exam. Okay? And obviously, we've got webinars going into detail by some of the top scorers in the UK, far better than myself, coming up very soon for you guys about how to actually smash it and get that top percentile. So do keep an eye on the group chat. And the fourth subsection is the situational judgment test. It's made up of four bands. Band one is the highest, band four is the lowest. As someone who, got band four consistently, and I managed to get that in my SJT as well, I would say the best tip I have for this one is to make a list of all the scenarios you come across and get a general idea of what sort of topics to cover. So what are the top tips used by top 5% scorers? People who are going 20 to 80 plus, which is a very, very competitive score. You score that, you're above, almost above everyone else. And that's every university open for you. The first thing you can do is, especially if you're year 12 right now, if you're year 11 or year 11, year 10, I just switch off a little bit. Don't worry too much about this UCAT. Focus on your GCSEs. But if you're year 12 right now, what I would say is try starting a bit of UCAT prep right now. So what that means is try to get involved with perhaps going online onto the UCAT consortium website. So if you just search that up and 15 minutes, a few times a week, sit down. Let's say you've got a study period or you're at home and you've got no revision to do. Open it up and just practice the three subsections I listed over here. So pick out verbal reasoning, decision making, quantitative reasoning. Just do a bit of practice. Get used to it. Because by the time when you get to the summer, when you actually have to prepare for the UCAT, what's going to happen? You're already prepared. You already know what you're expecting. Yes, you didn't time yourself. Yes, you didn't do the whole subsection. Yes, there may be some things you didn't quite understand, but you've been introduced to it and you sort of know what's going on. So that's what you want to do. You want to start by practicing little and often, 15 minutes a week, not a lot, a few times a week, okay? Cool, that's beginning UCAT prep. The next thing you want to do is once your UCAS exams or your mock exams over term, whatever you guys have, are done, you've got them out of the way. What you want to do is start your intensive UCAT prep. You want to book a date, and the UCAT date, all the announcements will be put out of when you have to book the date, etc. 6 to 8 weeks before your booked UCAT date, start your intensive preparation, which is, almost daily mocks. It's going through each subsection. Subscribing to Medify or Medentry, which are one of the question banks that are available, and getting a bit of practice in. Targeted practice on your weak points. Not overdoing it, but not doing too little. Okay, that's the first point. How to prepare. This is what the top 5% UCAT scorers do, okay? Every single year across our team. I've worked with hundreds now who from our students, from our team that have got this score, and this is the consensus of what we've received from feedback. The second thing is different exam mindset for the UCAT. The UCAT is not like your A levels. So the more hours you study, you're not going to get more progress, okay? So if I put 100 hours of UCAT prep in, it could all go to nothing if I don't look back on my mistakes. Or I could burn out because that's too many hours to be working. So instead, what you want to do is you want to have a mindset that I'm not going to do more hours. I'm just going to do focused hours only. And it doesn't matter how much I do. As long as I'm doing at least a couple a day, that's enough. I don't need to actually be doing, 6 hours of UCAT prep a day, which maybe might help you for your A levels, but it won't help you for your UCAT. It's focus specific revision. Why? Because burnout is a real thing for the UCAT. Okay, that's the next thing. The second thing is the UCAT is not like a typical exam. It's a very time pressured exam. People will tell you that this is like the 11 plus, but on steroids. Okay, for those of you guys who've taken the 11 plus exam, you're given 40 questions per subsection, let's just say, okay? And they're very easy questions. If I gave you all 5 minutes per question, you'd get 100% on the UCAT. But the issue isn't the difficulty, it's the time. The time pressure is real. And a lot of people struggle with that, which is why don't get too bogged down in answering every single question. If you go question one, two, three, four, if you go in order, you're only going to finish, I don't know, 60% of the subsection. And almost a half of it, you haven't even opened up yet. So what you want to do is triage. It's a very key skill, triaging. You're going to pick the easy questions, do them first, get them 100% right, then go back to the start and start doing the hard ones. What you'll notice is you've answered the easy ones and you've got them out of the way. Because who knows, maybe towards the start of your subsection is all the hard questions, and you don't get to pick up the easy marks at the end. So you do all the easy ones first, you skip through it, and then you go back and you start doing the hard ones. If you're running out of time, just click guess on all of them. I'd rather you guys focus on 70% of the questions and get, I don't know, 60% of those 70% correct, and the rest you guess and only get like 25% because it's 1 in 4 chance of get the 25% of the remaining 30% of questions right. Okay? As long as you get the bulk correct, don't focus on the rest. Instead of you answering every single question but running out of time because you've only done half the paper by then. So don't answer every single question. Guess, flag, and skip. That's the technique. Flag, guess, continue. Flag, guess, continue. Keep doing that. Okay. Cool. The next one. Track and reflect. This is the next key tip I give you guys. All of you guys, when you do your UCAT prep, should have an Excel sheet where you track your scores consistently. Okay. And what that's going to do is give you an insight of what works for you, what doesn't. It'll give you an insight into how many hours a day do you really need to study, perhaps what specific subsections are your strengths, what's your weaknesses, what do you struggle with, what do you need more prep with, and getting into your timing. And another key tip I have, this is a bit more niche, but it's called simulation. And I tell even my A-level students to do this as well. For the UCAT, if you booked it at 2 p.m., my UCAT was booked at 2 p.m., I would open up my laptop and do my UCAT prep at 2 p.m. every single day. Why? Because I'm getting my circadian rhythm into the flow of working at that time. So when my actual exam comes, it's a familiar environment. Okay? Cool. And that is pretty much it. The next thing is the personal statement. Now, the personal statement has been changed. It's had some changes in 2025 to 2026. So the last year's year 13s, when they wrote their personal statements and sent it off, theirs was different to every other year. So for example, mine was different. What's the key difference in the personal statement? What are the key changes? Now, what's actually been changed is instead of it being one big blob of 4,000 characters of text, it's been reduced down to 3 different questions. And I've listed the 3 questions over here for you guys to read. Okay? These are the key changes for the personal statement and what's happened. How much of a change is it? Not that much, actually. It's pretty much the same thing. Your content doesn't change. What you write doesn't change. It's just being structured and broken down a little bit. Okay? And that's the key aspect I take away. Now, for the personal statement, this is something you'll send off with your UCAS application. For those of you guys who don't know what UCAS is, it's essentially the platform where you apply to universities through. So for medicine and dentistry, you're allowed to apply to 5 universities, and only 4 of them can be medical and dental. The fifth has to be something else. Okay. And that's basically how it works. UCAS is just a little statement you attach to your application, which you send off in around October 16th. I think that's the deadline date. Okay, cool, cool. That's what it is. Now, what do the top 5% applicants do in the personal statement? I've gotten three tips for you guys to take away, and this is something I want you guys to look at. The first thing is the star method, the star plus L method, actually. I want to add the L at the end because it's very important. What is it and why is it important? The star plus L method is used for reflection, is to reflect on a certain experience, is to expand on it. So the first thing is, let's pick a random scenario. So let's say, I don't know, I went to the GP and I saw an anxious patient. What's the situation? I went to the GP in a primary care setting and I saw an anxious patient who was worried about their glucose levels, which means they've got diabetes, basically. Okay? Okay, that's the situation. What's my task? What did I do or what did the doctor do that I saw? The task was that, the doctor, they understood and they quickly, using their emotional intelligence, identified that the patient was unsettled and worried. Therefore, they lowered their tone, relaxed their body language, made subtle eye contact, and nodded their head repeatedly to assert the patient and give them a bit more confidence. Okay? That's what they did, the task. What happened? The patient explained that they've been trying very hard to, manage their levels by controlling their food, controlling their diet, and, they also identified that they've been doing regular exercise, but they also talked about the fact that they would keep slipping back into past habits. Like they would, reach out in the fridge, grab some crisps, and, diet's gone all over, and your glucose levels are high again. Your lipid or fat levels are high again. Okay? And they talked about how that was difficult to them, and they actually started breaking down. That's the action. So what did the doctor do about that? The doctor heard them out. The doctor gave them that golden minute to speak and vent out their emotions. Hear them out and then say to them, "Thank you for sharing that with me. I can understand that must be very difficult. Here's an exact action plan of what we can do going forward." And the doctor helped them set goals, break it down into increments of step by step what they can do every single week to reach that goal, and help them notice that. Okay? That's the actions. The result. What was the result? Perhaps, I don't know, let's say you went to the GP 2 weeks later and you saw the patient got better. Or let's say on the same day, the patient felt a lot better. They felt a lot more relaxed. They felt confident. They were motivated, and they were able to say, "Thank you, doctor. This is something I can work towards. It's not something I had available to me before. I'm glad you made me available to these things, such as resources the doctor may have given out." Okay? And let's say, I don't know, a couple of weeks later, the doctor follows up with you and tells you that this patient improved. Their lipid levels went down. They may, inform you of that. You can mention this in your personal statement too. Reflection. What did you learn? This taught me that sometimes the best way to deal with patients isn't medical treatment, it's advice, lifestyle factors, how they contribute towards health. Why will this make me a good doctor? Why does this make a good dentist? You can say that you can add the link bit. And the link bit isn't really compulsory. It's just a nice little bit to add towards the end. You can say something along the lines of, why will this make me a good doctor? A good doctor is someone who understands that the best way to treat patients is support them with lifestyle factors. The doctor who listens, or the dentist who listens, is the one who can best understand a patient's difficulties and support them in their lowest times. Okay? This is very important. I've spent a lot of time on this for a reason because the star plus L method is something of very importance that a lot of people miss out on. Okay, number two, how else do top 5% applicants prepare for their personal statement? They plan in advance. Okay, they plan in advance. What does planning in advance means? When they were in year 12, when they were in 11, they made a list of key skills they needed to cover, whether it's communication, leadership, empathy, supercurriculars, extracurriculars, work experience, reflection on hobbies. They built all of these things, made a list of them, what they've done and what they've shown as bullet points, kept a little notebook with them. So that when they got to year 13 or year 12, the end of year 12 in the summer, their personal statement, those 4,000 characters, that was smooth, that was easy. They easily got to fill out those pages, whereas you might be struggling to fill in characters because you may not have done that. So don't be that student, guys. Make sure you plan in advance. Find anecdotes for every specific example. For example, let's say for me personally, I worked as a chemistry mentor in my school and I mentored an autistic GCSE student and I understood they were struggling with their subject of A-level chemistry, sorry, GCSE chemistry. And as a result, I was able to understand what were actually the factors contributing to them studying. Was it stress? Was it burnout? Was it handling like 8 different subjects? Because that's what GCSEs is. And make a short little anecdote which you can always reflect on using this star plus L method over here, guys. Yeah? Okay, cool. The next thing, be specific. Why? Because it shows you what you as an individual took away from this. The final thing, talk about yourself. Make it personal. Link to your hobbies and interests. As Ahmed was telling us earlier, that shows you you're not a robot. It shows you do things outside of the career. sports, hobbies, whatever you like to do, anything. That shows you can maintain a healthy work-life balance. And also talk about the difficulty of the degree. At the end of your personal statement, or towards the start, maybe, mention, I understand that medicine or dentistry can be physically demanding careers that require a lot of emotional strength, but I'm ready to take this on and give reasons like I have good work-life balance. Obviously, elaborate on that. Okay, guys? Cool. So these are the key things we should include. Right. Here's an example of a supercurricular reflection. I'll put it up for you guys. Can I just get you guys to reflect on this and tell me if it's good or bad? And just give a short couple sentences on what you guys think about it. Is it too vague? Yeah, we can say that as well. Anything else, guys? No specifics? Okay. Ayan, could you unmute and tell me what you mean by it's too vague? No? Okay. It can be amplified if they specify what interests them whilst reading these articles. Exactly, yeah. They can be a bit more specific with this sort of thing. That's another thing they can mention. Thank you for that, Pastor. Pastor, do you want to unmute and tell me what in particular they could do better? No? Okay, that's fine. But yeah, thank you for your reflection. That's a really nice example you've included. Let's look at the next one. Okay, so here's another example I've got on my supercurriculars. And what do you guys think of this one? What do we like about it, and perhaps what could be done with a bit of improvement? And this is something that someone would write in their personal statement, for example. I'll give you guys just a minute to think about that. That's okay, Jan. Any ideas for this one, guys? It's gone into detail on what they read, how it interested them, and how they reflected on it. For example, further reading. Yeah, exactly. Yeah. So they've actually gone into the specifics. Remember, if I just tell you, I did a research project on antimicrobial resistance, this makes me a better medical applicant. That's not going to help you stand out. Mention specifically what you did, why it interests you, and what are the actual benefits of this movement that you're talking about, and talk about how this can be applied into medicine in more detail. Thank you for that. Yeah, so these are just a couple examples. Again, there's loads of different examples. I've taken this from one of our earlier webinars, which was on the personal statement. So the recording should be up on YouTube as well for you guys to go over. So there's other examples for you guys to practice with. But these are some examples we could have come across. Okay, cool. So you've done your UCAT exam. Hopefully you guys have smashed it now and got a top 10% score. You've done your personal statement, you've written it down, and you're ready to submit it. You've done your GCSEs, and hopefully you've got good scores on that. You've also done your predicted grades exams in year 12, your UCAS exams, and hopefully scored high on that. What's next? It's applying strategically, because in October 16th, you'll have to send off your application. Now, what you'll have to do here is send off your application via UCAS. You're only allowed to apply to 4 medical schools or 4 dental schools, and then you'll be given a fifth option. As a fifth option, if you've applied to medicine, you can pick 4 medical schools and a fifth dental school. That's allowed, and vice versa with dentistry. So if you're undecided between the two, that's still an option for you guys. Another thing you guys can also do is pick something that's not medicine dentistry if that's something you're interested in. Now, how do you apply strategically? Well, firstly, the number one resource available for that is our strategic applications guide for medicine and dentistry. So please do check out our link tree. It is available to download for free there. I would highly recommend you guys do that. That's the first thing I would say. The next thing is to look at your statistics. What are your strong points? Did you do really well in your GCSEs? You got those sevens, eights, and nines, but perhaps your UCAT wasn't the best. Look at universities that prioritize and highly weigh the GCSEs, like University of Birmingham, Leicester, KCL for medicine, Cardiff, Aston, and maybe for dentistry, universities that look at GCSEs a lot are like Leeds and Queen's Belfast, also KCL for dentistry. Or maybe your GCSEs weren't the best, but you really smashed your UCAT. What then? Oh, there's universities like for medicine, like Bristol, there's Imperial UCL, and lots of other universities that highly weigh the UCAT, East Anglia. So perhaps apply for those. Or maybe there's for dentistry, there's also high UCAT universities like, you know, Queen Mary's, KCL, Birmingham, they really look at your UCAT. So there's options like that, Manchester too. So yeah, okay, that's what you want to do. The next thing is look at the universities you've applied to and see is this a place where I'd like to be for the next 5 years of my life? Because that's what it's going to be. Do you like the city, the environment? Try to attend the open days. Speak to the students. Do you like the course structure of the university? Is this somewhere where you find yourself? Perhaps let's say you're someone who likes to be in urban environments, in a city environment, and you wouldn't like to be somewhere which is rural. That might be something that guides you toward a certain university. Would you like to stay at home? Would you like to, experience things and move out for a bit? Or perhaps, is there a specific research institution near the university that, it's affiliated with? For example, lots of London medical schools have very good state-of-the-art surgical centers, and some universities in Birmingham do as well. Perhaps look into that. Or perhaps you'd like to work in rural care as well, so you can look into universities that prioritize that. Play to your strengths, identify what you like, and apply strategically based off that. Again, we've got a whole guide that's literally like the number one resource out there for medicine and dentistry that goes into each university in depth. Please do read over that. And additionally, please do look at every university's website as well into the course. Email them, attend open days, try to speak to students if you can, ask questions on our WhatsApp community. There's likely a medical student or someone who knows about it on the chat. Okay, guys? Cool. The next step is you've sent off your application. Now the universities are screening people. Unfortunately, half the people who apply for each university will have to be rejected. And that's because cutoffs can be very high, okay? This is why it's important to apply strategically. But hopefully, we're not part of that half. We're part of the top half that managed to, get the interview invite after sending off our application. What happens then? Well, what happens then is you'll be invited to an interview, which can be of two types. It can be MMI or panel, which are the two structures. This generally happens from December to February time for medicine, and for dentistry, it can go as late to March, April. Now, generally speaking, the two different types of structures of MMI are MMI and panel. Now, MMI is the most common one, which is almost every university does now. It's essentially multiple mini interviews. That's what it stands for, where you'll be sent to a room, and within that room, there'll be like 5 to 6 mini rooms, and each mini room, you'll be placed inside of it for 8 minutes. So there'll be a timer, and that will be a station. That will be a mini interview. And you have an 8 minute mini interview with an examiner. They assess you, and then a buzzer rings, and you move to the next room. And then another 8 minutes interview occurs, and another one. And after 5 mini interviews, the whole circuit is complete. Or let's say, I don't know, you have 8 stations in some universities. You have eight mini stations, and it may be for 6 minutes, whatever. But it's basically mini interviews happening at the same time. Now, the reason they use this strategy instead of just a panel interview, which used to be more common previously, but it's almost extinct now, is because it allows different examiners to assess you, so it's objective and less biased, and also because they can test different skills for each one. For example, certain stations like to test your non-verbal communication, like role play, and other stations like to test your, you know, understanding of the Korean medicine, your motivation. And some stations may, test your analytic abilities. Like I've been given stations where I had to interpret like a newspaper article on some nothing to do with medicine, it was to do with housing. And I had one station where I had to listen to a GP audio consultation in some of my interviews. And I had to look at some images and interpret them. You might get weird and wonderful things. For dentistry, they like to give you manual dexterity stations where you have to work with your hands. So the point being is that for your interviews, there's loads of different station types. So that is one thing you need to prepare for. Now, and again, this is the list of station types, which sort of covered already. Again, MMIs, some may say, and a lot of people hold this view, that this is actually the hardest stage of the application cycle. And for me personally, when I applied, I think it was for me. It was definitely my hardest. Because I'd never done an interview before. I wasn't confident speaking as I am now. I would stutter after every sentence, and it was just a nightmare for me entirely. So, what do the top 5% applicants actually do in their interviews? How do they convert it into offers? How do they build that practice up? Now, the first tip I want to give you guys is get out of the mindset that this is preparable. It's not something you rinse and repeat theory for, like an exam. It's not an exam, it's an interview. Learn to speak. And that's why the first point is practice over theory. Practice speaking in front of people. Pick a topic, speak about it for 5 minutes, and be as coherent as possible. Explain something to someone. Identify certain things within medicine. Do a bit of reading. Perhaps an hour, read on, I don't know, a hot topic like junior doctor strikes or organ transplantation, or let's say, I don't know, fluoridation for dentistry or dental deserts or whatever it may be, public health. And after you've done that, read it for like an hour, done a bit of reading, made a few bullet points, blindfold yourself. No, don't blindfold, but like turn off your notes, sit down in front of someone, get like a sibling, a parent, or someone you know that's a doctor, dentist, maybe. Ask them, can you just sit down with me and practice interviews? And for 5 minutes, time yourself and speak to them and ask them for feedback. You also want to record yourself speaking. Why do you want to record yourself speaking? Because you can watch the video back and see, were you nervous? Was your body language moving okay? Was your tone of speech clear? Was your pacing in point? Were you clear with your sentences? Were you making sense? Were you direct to the point? Or were you beating around the bush? Did you know what you were saying or were you confused? Look at these things. Was your timing okay? That's your verbal communication. Then look at your non-verbal communication, your hand movements and your gestures, your eye contact. Do you look nervous or do you look like someone who's confident and willing to study at that university? Okay, cool. That's another thing we can assess. And another key tip I'd say is every station is different, meaning that you can use the same anecdotes for different stations. For one of my interviews, I used the same example every single time that of my EPQ of where I read into specific medicines, and I used that for my time management example and how I can manage my time with assignments, etc. And they loved that in my interview, and that's why I managed to get the offer by the end of this. Okay, so use the same story. It's a different examiner every time, so do that if you need to. But obviously, do that at your own will. Do it thinking about what make it relevant to what you need to say. Okay, cool. The next thing is some stations can be ethical stations where you'll be given an ethical scenario. So this is one of the key ones we need to know about. Treat it like an essay structure, meaning introduce the topic, give them a title. Like for example, let's say the scenario is about abortion. Introduce it. Abortion is allowed in the UK within 24 weeks of pregnancy, and after that, it is no longer legal. Okay, introduce the topic. Then go into some of the pros, one side of the argument. What people who follow the pro-life approach believe. For example, people who believe pro-life are of the view that it goes against the ethical pillar of non-maleficence to harm a baby. The baby has a right to live, okay? And they link in their ethical pillars by saying that the ethical pillar of non-maleficence, and again, we'll go into this in more detail when we do MMI webinars, but there's some ethical pillars we need to know about. It talks about not killing people essentially and giving children the right to live, okay? That's one thing. However, people of the pro-choice argument say that a woman has a right to choose about her own body, and that might be an argument that they put across. So what you want to do is you want to introduce the topic, give the pros and the cons, bring in the ethical pillars, and at the end, give me a nice, clean, neat conclusion by saying, overall, I can understand both sides of the argument. Personally, I believe this because the pros of this outweigh that. Okay? And just like that, finish it off. So follow the essay structure for scenario-based or, ethical scenarios-based stations. The next thing is buzzwords. Use them appropriately. Does anyone know what these mean? Can someone just type in the chat? Does anyone know what evidence-based medicine is? These are some of the buzzwords we might need to know. Feel free, guys, to unmute with this one as well, if you just want to say the answer. Oops. No, no one knows what evidence-based medicine is. Okay, evidence-based medicine is basically research within medicine that shows something works. For example, this might be useful to mention in an interview. Let's say you're dealing with a patient who doesn't know what they're doing. We can talk about using evidence-based strategies, which is, For example, let's say a patient struggling with controlling their weight. You can say the best strategy is actually to walk little and often. So walk in a day. Don't just go and run a marathon the next day because you're overweight. Do a little bit at a time, and that's what's going to help you lose weight the most. Instead of just running a marathon one day and completely neglecting your health later on. Evidence-based medicine talks about research, okay? What studies show, what things indicate, all right? Cool. The next term is public health. Now, public health is another key term. And again, there's millions of buzzwords. I've just picked out some certain ones to cover, which commonly come up in your interviews. Public health talks a bit about it's basically a body within the government that makes decisions about the public's health. So they govern health at a community scale. So examples of this is taxes on sugar. So we make taxes on sugar to reduce the overall intake and hopefully de-incentivize it so that there's less sugar intake and therefore less strain on the NHS for primary care services and obesity services. Okay, so these are some of the keywords, and obviously multidisciplinary team. I'm sure you guys know what that means. Okay, cool. Once all of that is said and done, you guys will be given an offer. Congratulations, you guys smashed your interviews and managed to get an offer. What comes next? Well, you'll be hopefully given an email and they'll give you a conditional offer, basically meaning that congratulations, you've done well. Now you can become a medical student or a dental student on the basis that in year 13, in the summer, you achieve either A star AA or AAA or whatever conditional offer they give you. Okay, guys? So that's what a conditional offer is. Now, the reason I've mentioned all of this is because all of it goes for nothing if you don't get the grades. So make sure whilst you're focusing on your application, you're putting in work daily, at least an hour or so for your A levels to keep on track with your grades. Okay? It's a very important factor of the application cycle. Okay. And again, we've re-emphasized that on this slide. All of it doesn't matter if you don't get the grades. And the reason we emphasize this is because year in year, time and time again, we see people get into medicine, get into dentistry. They get the offers, they've done the hard bit, but they slip away at the grade, the A levels. And that's what a lot of students find very difficult. Okay, guys? So this is one of the key things. Now, briefly to touch you guys up with what's next and how you guys can get involved. For supercurricular activities, we've got a Medentors Society essay competition coming up. So that's one of the key things we can discuss. Another thing is we've got a webinar coming around 30th of May, very, very soon, on the UCAT. And it will be going into how to get a top decile score for the UCAT because a lot of you guys are interested in that. It's one of the key application cycle phases and it's something you guys want to do well in. We've also got some of our courses, the Medentors Summer Intensive course, which is led by top scoring decile students who achieved 4 out of 4 offers at universities on how to smash it and get 2300 plus for your UCAT. And again, for interview prep, we've got interview mastery course that does the same. And if you want us to visit your community center, your school, etc., just DM our Instagram at Medentors, which we've got listed over here. Okay, cool. And here are some of our guides that are available. We've got a Getting into Medical School guide available for free. Just click on our link tree and you can just download it and read it. It has the tips in this webinar sort of summarized. Okay, guys? Now, for those of you guys who aren't in our WhatsApp community, here's a QR link to sign up for that. Now, I did mention earlier in one of the slides that all of it doesn't matter if you don't get your A-level grades, which is why a lot of students do struggle with that. So what we've done is we've built Medentors Academy, which is a tuition branch where we essentially pair students with tutors and mentors who assist them in getting those top A-level grades, those top GCSE grades, pushing for 8s and 9s, pushing for 11s, A stars and A's. Why? Because that's what's actually going to get you and secure your offer. What that does is it gives you accountability, it holds you accountable, and it gives you an evidence-based way to track your grades and make sure you're on top of your past papers through a tutor. And again, students who work by us increase their grades by at least 1 or 2 within 6 months, significantly more than they would at school. Okay, so this is an amazing opportunity I would ask you guys to definitely look into. And you can book a free consultation with a tutor to get involved in this thing and target on your specific weak points 1-to-1. Okay, guys? So that's one thing I'll leave up for you guys as well to look into from this link over here. Okay, cool. So now I've done all the explaining. I've left it towards the end for you guys to ask any questions. So feel free to ask any questions that come to mind, guys, okay? What are the tips to approach questions on the UCAT website used by higher approaching students? What's considered competitive GCSE scores? Which would apply to more GCSE heavy unis? Very good questions. You got 2 questions over there. Let's start with the first one. UCAT, how to approach it. Tips for looking at it. Right now, it's not the summer, so don't worry too much about the UCAT. Just learn what the specific subsections are. Learn what a verbal reasoning question looks like. It's a long passage where you just read through it, and then there's a multiple choice answer, and you pick the answer that best fits it. Okay? Learn what that looks like. The next section is decision making. Learn the different puzzles and stuff. There's no need to learn the strategies and the techniques. That specifically, I can't give you an answer because every question type has a different strategy, a different approach. But the general strategy for verbal reasoning is to scan through text. So get very comfortable with speed reading, scanning, and picking out keywords from the question and the answer. For decision making, it's more about there's so many different question types, but generally it's about using your paper because you're given a little notebook where you can use a piece of paper to jot down your notes and ideas. And for QR, quantitative reasoning, get good with your mental maths and using the UCAT calculator. Because you're not allowed to bring your own calculator to the UCAT, you have to use a computerized one over there. Okay? Cool. Um, Second question was what good GCSEs are used to apply to GCSE competitive universities? Okay, general rule of thumb, if you get sixes, seven, eights, and nines, it's not the end of the day for medicine if you want to do that. However, if you want to stand out on you and if you want to apply to universities like Leicester and Cardiff and Newcastle, which really look at your GCSEs, or UOB, Birmingham, get those eights and nines. You need like as many eights and nines as possible, and that's going to give you the best chances. But if you get a good UCAT score, that might be able to nullify it. Are there any free websites to prepare for UCAT early? Yes, there's the UCAT official website, which is the UCAT consulting website. They've got free question banks. That's to start prep. And there's also PassMed, which is another free resource. Again, when you start your intensive preparation, you're going to have to subscribe to Medify or Medentry. Those are the only two good question banks that we recommend. And if you want a discount for that, we've got a discount code for you guys. So don't buy it before checking our website. You can get 15% off. So make sure you ask us in the chat and we'll send it to you before, okay? Um, okay, why medicine? How do you answer the question in interview? Okay, um, bit weird, but I'll give you a short example of how you would answer why medicine. Essentially, to answer that question, you have to make it personal to yourself. You have to talk about what made you consider the career in medicine, what interests you, and what skills you need to look to develop. If you want specific examples of that, just please check out our webinar. I can't really go into that into too much detail because that would take a while to do, but do check out our webinars of why medicine, how to answer that question. And I've also got a page on TikTok where I've posted an answer of how to structure that. So do check that out. But generally speaking, the tip I'd give is break why medicine down into why you want to do the career. What was your initial exposure? Then, what interested you into reading further, and what your work experiences showed you. And then finally, what you can do to better improve that. Again, what you can do, sorry, to show that it links to you. For example, linking it to your experiences as school captain or a mentor, showing empathy, communication, leadership, time management, whatever skill, okay? Again, this is something we'll look at more into December time when your interviews come around. Okay, I'm finding it hard to link my EPQ topic I've done. How should I go about writing that to my personal statement? Very good question. My EPQ actually wasn't even on a medical topic, like technically, okay? So don't worry about writing an overly medical EPQ. For your EPQ, you can say something along the lines of an EPQ helped me manage time management and improve on my skill of balancing different tasks at once. It also introduced me to evidence-based medicine, how to do research, make references, which prepares me for university life and assignments. That's a good enough reflection for an EPQ. That's something you can bring into it. But if you want to link it to your actual, but if you are doing a medical EPQ, the way I'd link it would be to say things along the lines of the fact that what specifically have you gone into and how you reflected on it. So an example would be, let's go back to this slide. The supercurricular example. Imagine your EPQ now was on antimicrobial resistance. You can talk about it by linking it into how you read further into certain things. I hope that helped. So I do, next question is on my A levels and have exams for my subjects in year 12. When should I start preparing for UCAT? Your exams finish around 23rd of May. So you can book your UCAT quite late. You can even book it as late as September. So book your UCAT later, give yourself a bit more time, and 6 to 8 weeks of that, start preparing before. So let's say your UCAT starts in, let's say your UCAT's in, you're free from end of May. So June you're free. Book it towards the start of August or mid of August. That's when I did my UCAT. I did my UCAT like August 18th, around about then. So give yourself time. Um, but yeah, yes, EH or GCSEs are perfect. Those are very good. What's my TikTok? At Mufti Medic. Um, on on TikTok. Check that out. I don't post on it as much, guys. Due to like health reasons I have, but hopefully when I'm better, I'll start posting on that more. But yeah. It's got really good videos on there for past stuff. Any other questions? Do you recommend booking the UCAT later, or do you say it becomes more competitive then? Very common question that we get, Aya. What I would say for that is book the UCAT whenever you're comfortable. Don't leave it till too late. There's something called a UCAT curve, and it's in one of our past webinars that when you do your UCAT, when you do your UCAT preparation, you gradually improve at the start. You'll see your score improving. You're going to start off with a low score like 1800, 1600, but you're going to get to that. But eventually, you're going to start getting higher. You might get 2200, 2100. You get those high scores. But if you keep preparing for too long, you'll start to drop off. So don't leave it till too late. Don't give yourself too much time. Remember, UCAT burnout is real. It's a very real event. The top UCAT scorers prepare 6 to 8 weeks intensively and a bit before as well, beforehand. Okay, I hope you found that useful. What medical school are you at and why did you choose it? Very good question. I'm currently studying at Aston University. The reason I chose to study here is because I live local, very close to Aston, and I managed to achieve 3 out of my 4 offers mainly for medicine. So the one offer I didn't get was for Leicester, and it's a very long story of how I didn't get that, but essentially I wasn't very well prepared for my interview. But because based off that, what I did is I emailed them and asked them for feedback in my interview. And based on that, I improved for all my other interviews, improved my skills, which is why it's very important to ask for feedback and manage to secure the rest of my available offers. So the reason I chose it is because I wanted to stay home locally and I like Birmingham. It's a very nice city, despite what people say online. Lead the Medent Society. How can I contact Medentors? Yeah, so just what we can do is if you, to contact Medentors is just DM our Instagram. So at Medentors, you can DM us and say you can get into contact with us or speak to your head of year and tell them that um hi, I'd love to get Medentors to come into the school that I'm at. Or alternatively, you could email us medentors@gmail.com. I'll put it in the chat and we can come into your school. Okay. Um, any other questions, guys? I see many doctors online who say they regret medicine, and there's a lot of negativity. You're in med school with more experience. Do you agree? Okay, guys, I had a whole webinar on this. So, again, if you want an extended answer on this question, go on our YouTube and watch Medental Society episode 4, which was just me talking about life as a med student. A short answer is there's a lot of negativity, which is why get your work experience and make that decision early of whether it's what you want to do. Okay? Get your work experience because that's what's going to tell you if it's the career for you. Speak to your doctors. Can you see the step over here? Let's go back in our webinar. You guys see this over here, yeah? Where is it? Yeah, deciding if medicine is right for you, do this step. Make sure you get good at it. Identify it. Don't feel pressured by family, friends, people around you, friends at school. A lot of schools, the grammar schools as well, kids are applying for medicine and dentistry. And it's just peer pressure. And you get a bit of FOMO, like, oh, my friends are doing medicine. That's actually why one of my friends at med school is actually doing it right now. It's kind of wild because all of his friends did medicine. I went to secondary with him as well. So you might feel a bit pressured. Don't look if it's the right career for you, get a good insight, speak to professionals, watch our series on Medentals Society. That gives you the best, honest, realistic insight. Look around you and pick if it's right for you. Me personally, the reason I want to do medicine is because I know it's a very broad and open career. I'm personally very interested in science. I know I can go into whatever I want. I know that I'm going to find something I'm interested in and I can go into it. And hopefully, I want to build skills outside of medicine, like, for example, running a company or entrepreneurship or social media, these sorts of other skills I have. So I don't have to work full time as a doctor. And this is just something that's just a skill I have. And I also want to use my health literacy to, have other endeavors or things, businesses, whatever I want to run in the future. Okay. So for me, that's my reason for doing medicine. It's something that I don't want to be a doctor just for the sake of it. I want to do it because I actually enjoy it. And for some people, that might be their reason. Other people, they just love a certain specialty. Like one of my friends, he works at Medentors, Ibrahim. He's one of our founders. He's very interested from a young age in um interventional radiology. It's a specific specialty where you take x-rays of people and you find certain lesions or holes or problems or clots, and you using that x-ray surgically dig into someone and remove certain material, etc. And he found that really cool. And he just wants, and that's why he wants to do medicine. He wants to go for that specific specialty because he loves it. Some people just love medicine. So yeah, that's what I'd say. Find your why, honestly. That's the key tip I'd give. And also remember, it's never too late. Like if you want to drop out of med school, it's okay. Like a lot of people have in my year, and that's okay. It's never too late. People say, "Oh, it's too late. You're in your 20s now. You can't drop out. You can do another degree." That's fine. You can, as long as you make an informed decision and you've got background plans. Send your YouTube link. It's just at Medentors. It's like the simplest name ever. Is surgical work experience seen as less relevant? No, no amount of work experience is more relevant than another. As long as you've done it, it can even be online, in person for 1 day, 2 days, 50 days, 20 days, a year, not a year. But you guys get what I mean, right? It doesn't matter how long you do your work experience for. For the five choices I have when applying, if I choose three medicine options and two non-med, does that make me look? No, no. Universities don't know where else you've applied. They don't know. So it doesn't look contradictory. But I'd say if you want to maximize your chances of getting in, just pick four because that's an extra attempt to get in. Like if a football player takes four shots, they're more likely to score than if they take three. So think of it from that perspective. Do Medentals do mock interviews? Yes, we do. We do mock interviews. That's around December time. We'll go into that. We also have courses for UCAT and interview preparation over the summer. We've got a summer intensive course starting around towards June, July. So definitely do keep an eye on the announcements for that. Okay, cool. The only thing that worries me most about choosing medicine is the night shifts, on-call weekends, rest I'm generally interested in. Don't know if it's worth it. Very good question. So night shifts, on-calls, all of that stuff, it's not always present for every specialty. If you want to be a GP, you don't have to do night shifts. You don't have to do on-calls. You don't have to do emergency shifts. If you work in psychiatry, generally you don't have to do that stuff unless you work in a setting that allows you to go into that realm. And there's many other specialties where you don't have to do that. And there's also options for part-time work. There's also option for working strictly 9 to 5 schedules. So yes, you will have to do night on-calls, night shifts for at least F1, F2, definitely. Those first 2 years of graduating. That's unavoidable. It's like a canon event. You can't skip it. But going into it later on, there's many specialties that allow you to avoid this and have a good work-life balance. So don't be worried about that.